Ever wondered why your health isn't just about the choices you make, but also, well, your address? For decades, scientists maybe had a bit of a blind spot when it came to something as basic as where you live. Today, we're doing a deep dive into how place really shapes health and a revolutionary new way researchers are finally seeing the whole picture.
Yeah, and we'll be digging into some really crucial insights from research across epidemiology, sociology, geography. Our mission today is basically to unpack the difference between that traditional view of place and this transformative relational perspective, and hopefully uncover why your location is so much more than just, a dot on a map.
Okay, so let's start there. How did traditional health research usually think about place? Lay the groundwork for us.
Well, for a long time, research tended to look at place as this kind of fixed, independent thing, almost separate from, who lives there. It treated areas, like neighborhoods, as these distinct bounded units, almost like little islands, completely
No
separate.
islands. Okay. And what was the main downside to looking at it that way, that isolated approach?
Yeah, the fascinating thing is this conventional view often severely underestimated how much place actually contributes to disease risk. Seriously underestimated by sort of ignoring all the complex dynamic connections between places and people. Researchers might end up saying, oh, only a tiny bit of health variation is down to context just because they weren't equipped to see that bigger interconnected web.
Wow, okay. That sounds like a huge shift then. So this research argues for a relational view instead. What's the really mind-blowing part about this way of thinking?
Right. Here's where it gets really interesting. This research pushes back hard against what they call a false dualism.
Hmm.
That mistake of treating a person's individual habits as totally separate from their surroundings. The relational view sees this mutually reinforcing back and forth relationship. People shape places, and places are constantly shaping us. It's not one or the other.
A two-way street. Okay, so if places are more like dynamic nodes and networks,
Yeah.
right, influenced by things happening at all different scales, how does that mess with our usual ideas of things like community or even just plain old distance?
Oh, completely. It means our idea of distance becomes way more complex than just, how many miles are between point A and point B. It's about socio-relational distance, just as much as physical. You could have two neighborhoods right next to each other, but they might be worlds apart because of economic barriers or different social networks, maybe historical divides. That creates a kind of health distance, even if they share a border. And remember, these places are shaped by all sorts of actors, everyone from local individuals making choices up to global corporations or even big cultural shifts.
That relational view sounds incredibly powerful. Like you said, it's almost like finding a secret code to understanding health patterns. But how on earth do researchers even start to measure something that sounds so fluid and interconnected? It seems really tricky.
Well, that's the challenge, right? We definitely need more multi-dimensional tools. Imagine using things like GPS tech to create time-space biographies.
Hmm.
So not just tracking your home address, but mapping out all the environments you move through during your day or week. Your commute, where you work, shop, socialize. Those simple neighborhood measures we used to rely on based on just fixed boundaries. They often massively underestimate a person's total exposure to all the different environments that influence health. They just miss all that dynamic movement.
That really makes you think, doesn't it, about your own day, all the different zones you pass through without even realizing. Could you give us a really concrete example, something relatable, maybe food? How does the relational view work there?
Absolutely. Food is a great example. So think about diet and food choices. A conventional view might just map out food deserts, areas lacking supermarkets,
Yeah.
and sort of stop there, lack of access.
Right, that's the classic example.
But a relational view digs so much deeper. It reveals how financial barriers might stop families buying healthy food, even if it's technically available. Maybe they can't afford bulk purchases or lack transport. Or think about social connections. Someone might keep shopping miles away in the neighborhood they grew up in because of family ties or habit, even if a new store opens right next door. It's not just about proximity.
Ah, okay. So it's not just if a store is there.
Exactly. And it goes even bigger picture, too. Think about macro level stuff, like, say, the European Common Agricultural Policy influencing the price of fruits and vegetables across whole countries, or global corporate decisions, like McDonald's rolling out its dollar menu specifically targeting lower-income areas. These huge, distant decisions, they can have really profound effects on local health outcomes, like obesity rates in ways that just looking at local store locations would completely miss.
Wow. That shows how decisions made miles away, or even globally, filter right down to local health. So bringing it all together, what does this really mean for you, the listener? What's the takeaway?
Well, I think understanding place relationally means we need to move beyond thinking about simple boundaries on a map. It's really about seeing health as tangled up in these interconnected systems, local, national, even global systems, and seeing how individuals and places are constantly, shaping each other in this ongoing dance.
And that knowledge seems absolutely vital if we want to create public health policies that are actually sensitive to the real context, policies that might actually work.
Definitely. And maybe here's a final thought to chew on. The next time you think about why some communities seem healthier than others, try looking beyond just the obvious visible stuff. What kind of hidden networks or maybe distant decisions might be playing a role that you hadn't considered before?